Hello, everyone, and welcome. Thank you for joining us this afternoon, this evening, this morning, depending on where you are. My name is Alli Bunting. My pronouns are she and her, and I am the Manager of Programs and Operations at CanWaCH, the Canadian Partnership for Women and Children's Health. During this COVID-19 period, I've been going out for many walks outside, enjoying the trees, the water, nature, the fresh air. And this has really filled me with gratitude. And it's reminded me of those who have come before me, who have cared for and stewarded the land. And in Victoria, in particular, where I'm located in Canada, I would like to pay respect to the ancestral, traditional, and unceded Indigenous territories of the Wasanich, Sartslip, Tsleil-Waututh, Lekwungen, Wyomilth, and Sooke Coast Salish people. And I know that I'm joined by many from across Canada today, and I recognize and honor all Indigenous communities and territories across Turtle Island as well. So I personally am very excited for today's webinar, and I'm keen to be here with each of you today. Today's webinar is focused on operations, which is inclusive of finances, human resources, IT and virtual systems, and policies and procedures. And I started at CanWaCH just over 3 years ago now, and didn't necessarily at the onset see myself in operations. But I've learned a lot over the past 3 years in terms of what operations actually means. And many of the moments that I've had and the learnings that I've come across is that operations is often the behind the scenes coordination of what happens. We often work in operations with people from very technical backgrounds, including human resource professionals, accountants, lawyers. And so for some organizations, operations is a one-person side of desk affair. And for other organizations, there's whole departments dedicated to operations, human resources, and finances. So I am fully cognizant and aware that each of our organizations is very unique in how we are set up in accordance with our bylaws and our own internal policies and procedures. But that often as operations colleagues and operations professionals within our sector, at least, we don't often get a chance to check in with each other and see how we are doing. So for me today, that's why this webinar is special. And I really look forward to your questions and your comments as we start a dialogue amongst ourselves that I hope that can continue over the weeks and months to come. So please feel free to pose questions or comments or give us an update in either the chat box or the Q&A box. Alongside me today, we're joined by two fabulous speakers. So I'm joined by Terry Gillis. He is the president and CEO of Ahria Consulting. And Terry, if you just come off mute for a second, we can see you, perhaps.
Why am I not coming off mute? There we go.
Yeah, there you go. Awesome, thanks. So Terry will be speaking today about the management and human resources in the current COVID-19 context. And alongside Terry, we have Brenda Beattie, who's the partner in tax services at Davis Martindale LLP. And Brenda, if you just go off mute for a second, we can see you too.
Hi there.
Awesome, thank you. And Brenda will be joining us today to particularly focus in on some of the federal government programs that are available for nonprofits in this current context. Following that, we'll also be holding a Q&A session. So as I've said, please feel free to write down any questions or comments that you have, and we'll do our best to get through all the questions today, but we'll also be compiling them all, and if there's anything in particular, we can circle back afterwards. So in my experience and in my professional life, my volunteer life, the conversations that I've been having with my colleagues and friends and other volunteers is that we have been tested over the past 2 months. We've been tested in terms of how we operate and the systems that we use. At a staff meeting this morning, I was reminded by a colleague that for us, it's been exactly 2 months as a marker of since when things have changed. And it's a little bit of a shock to realize that it has been 2 months. But I think it's also a reminder of the fact that though we have faced challenges during COVID-19, we've been tested, we are here. We're getting by, we're getting through. We might just be getting by, or we might be thriving, and one day may feel different from the next. But we are adapting, and we're demonstrating our resiliency as a sector. From the survey that was part of the registration, we were hearing from you general trends in terms of the top topics for conversation. And most of them focused on government financial support during COVID, government payroll support, financial reporting to funders, but then also this large portion around how to support managers and employees during this time period in terms of communications and relationships, how to manage performance virtually, and how to effectively communicate with employees as we go. I was also cognizant as I was reflecting on your input into the surveys that there's many other unique challenges that we're facing as a sector, and that operations writ large is very broad in terms of the scope of work that we take on. So there was also comments that were submitted regarding having to replan work plans and budgets, and having to retool our systems and our processes in terms of accepting non-electronic payments, accepting electronic payments, online banking as well. And then alongside that is all the challenges of programming overseas and working with local partners too, which has become all the more challenging in this current context. So I hope that in hearing this list of things, you can hear yourself in these and take some comfort in knowing that you and us, we are not alone, that the impacts of COVID-19 on operations and on the nonprofit sector as a whole has been widespread. In terms of CanWaCH, as we kick off this presentation, I'd like to offer you a little bit about what has worked for CanWaCH. So as a caveat, I know that we have created ourselves as a completely virtual organization from the get-go. Since day one, we have been virtual, no brick and mortar system or setup, and we intend to remain so for the foreseeable future. So that we have had the time to have systems put in place gradually, and we know that systems and policies and procedures take time to put into place. But that we've learned things along the way of what has worked well and what has not worked well, and created structures to support a very vibrant, high-functioning staff team that is spread across Canada in doing really high-impact work at the same time. So in terms of things that we've learned that have been kind of reinforced during the COVID-19 period in terms of what is important, is some key topics around flexibility, accountability, and being compassionate as employers. So I remember when I first started working from home for CanWaCH, it was easy for the work day to bleed into the evening. And it seemed as though if I was not sitting at my desk 7.5 hours a day and being actively productive for every single moment of that, that I was not proving my worth and my value to the organization, that I was not maximizing my efficiency. And it really took a little bit of time for me as an individual, and as I have worked as an HR manager at the organization, to work with staff that have come on board, to feel comfortable in a virtual workspace, to feel connected to colleagues within a virtual workspace, to feel as though you can step away but still be there and be present, and to create that separation between work and home life, or private and public spaces at the same time. In general, at CanWaCH, I think we have placed an added emphasis on clearly delineating tasks and assignments, and really being proactive about of calculating what productivity should look like for our team. But that's had to be recalibrated within the COVID-19 context as well, for certain staff. And I think what is important across all of these is knowing the uniqueness, having a finger to the pulse in terms of how your team is doing, to know how you need to adapt work plans, work schedules, what productivity would look like within a COVID-19 context or not. So I think that the work that has been accomplished to a high degree, but that there have been changes, and we've had to make some changes along the way over the past 2 months to take into account different accommodations that have been required. But having really clear lines of communication between employer and employee has really helped us within this space. In terms of creating realistic expectations, it's always having clear conversations about productivity and having a clear sense of what an employee needs at the outset of a project. And it requires having a circle of communication of not just giving a task and then not following up, or not just outlining what a project would be, but having those touch points along the way continuously in terms of when things have gone well or things have gone not so well at the same time. So this regular feedback has been key for us in terms of what we do. We have weekly touch points as teams. We have bi-weekly touch points as a full organization, and either weekly or bi-weekly meetings between employee and employers. And there will be challenges that will come up. That's to be expected, but being proactive in addressing them as well is equally important. Being proactive in addressing them, but compassionate at the same time. And it's finding that flexibility between those two and being flexible within this context. And we know that it's challenging for employers who are trying to ensure some of the more operational pieces, or ensuring the overall financial resiliency of the organization, which requires certain outputs and deliverables, alongside supporting human resources and supporting your staff during a moment of uncertainty and unprecedented changes to work-life balance. In terms of how we set ourselves up, we've tried to build systems that ensure mutual accountability between employer and employee, and multiple accountabilities as well amongst all staff. So in terms of our operations, we use a platform called GLIP, or Ring Central. And on this platform, you can see when your colleagues have joined at the beginning of the day. So I really feel as though I arrive at the office every morning. And it's kind of almost like a Facebook for work scenario. But on this platform, we can manage all internal communications, project management. You can break down and assign each other tasks, communicate about projects, and complete projects at the same time. So it's one integrated platform. And I think for us, it works really well because it actually operates as a virtual world, more or less, for us to connect with and to build a really vibrant team for all of us. And I think it's important to know that we have accountabilities between supervisor and supervisee. We have accountabilities within teams. We have odd assortments of people who work either on a project or just in terms of social fun at the same time. So for example, I'm part of a team on GLIP that shares photos of my cat and their cats and our pets. And those moments are as important or equally important to the task that I need to get done for a colleague at the same time. And making space for those social relationships to be built and to have organic team building exercises is of paramount importance, especially in a virtual world. Because we've learned that in a virtual space, we don't know when someone is struggling necessarily. We can't walk by a desk and read body language or body tone. So it really requires active communication, over communication across many, many things. Final point, and then I'll quickly run over finances, is compassion. It's compassion first, compassion foremost, and remembering that staff are humans first, and that COVID-19 has presented unique challenges. But that also remembering that managers often put in a lot of emotional labor into managing employees and managing staff. And we need to show compassion for them for staff, but also for ourselves at the same time, and really put ourselves first as well in terms of demonstrating personal leadership in self-care. It's kind of like the analogy of the oxygen mask falls down and you need to put the mask on yourself first before you can care for others. So really making sure that we're solid in our own work before we help others. And noting that compassion does not mean complacency. So even during this time, it will likely exacerbate or make bigger the things that are working well and the things that are not working well. So some of you may feel like the small problems that were there before you had to move virtual are now compounded and expanded, but that there's no reason why not to address those in a compassionate and compelling way at the same time. Nicole, if I could get you to switch over to the next slide. Very, very briefly, we have built up a financial system that is completely virtual, completely paperless. It's taken some time for us to get there. 4 years ago when Julia, our COO, started, we didn't have a payroll. So everything has been built up since then, but we manage everything online, from accounts payable to receivable to banking to payroll, timesheets, etc. And we would love to talk to you about it. And I think I'll leave it at that in terms of if you would like to talk to us about what our approval processes look like or our banking system, please reach out to us. We would be more than happy to take you into our back end. We can share a screen with you and show you all the parameters of what we do and how we do it. I know that it can take some time to adjust financial processes and procedures, but it's also, it's also possible at the same time. So I will leave it there in terms of CanWaCH as a bit of a case study for what operating virtually can look like. And I will turn it over to Terry. Over to you.
Awesome, thank you. So I'll start off with just explaining a little bit about my company. We're an HR consulting firm, and our primary mission is to ensure that everybody has a great place to work. That kind of is our rallying call. And it's in that context that I thought I would speak a little bit about specifically leadership as it pertains to a crisis like the one that we're faced with today. We'll go ahead and flip to the next slide. I don't need to look at myself that much. I'm not that good looking. So anyway, so how does one lead through transition effectively? And I put the picture of a flight attendant up there. Some of you may remember what a flight attendant does a few months ago when we could travel. It's been a little while since most of us have probably seen a flight attendant, but if you're on a safety briefing on an airplane, those of you who paid attention, you know that when they talk about in the unlikely event of an incident that an oxygen mask would fall from the ceiling, they instruct you to put that oxygen mask on yourself first. And the reason you do that, of course, is that if you try to help somebody else and you haven't helped yourself first, well, you're probably going to asphyxiate and you're probably going to be of absolutely no value to anybody. So although it seems contrary to, look after others, when it comes to leadership, we sort of listen to flight attendants and we advocate that you need to look after yourself first, else you're of very little value to anybody else. And only once you have done that, only once that you've had the opportunity to take care of yourself, can you really start to look after others. And that's very contrarian. That's somewhat, for some people, actually a little bit offensive because they feel that, servant leadership, we should be serving others. I agree with all that, but let's take a look at ourselves first. So in that context, we'll flip to the next slide. That would be fantastic. So, I'm a big fan of most business problems can be broken down into a 2x2 matrix. So my presentation has a 2x2 matrix in it. And if you look at the columns are what you can control and what you can't control. And the rows are where you could be putting your mental energies in terms of what you're thinking about and what you're not thinking about. And as you can see, we are a strong proponent of, when you're in a leadership role, to really be focusing on those things that you can control, and more importantly, to be thinking about those things that you can control. So as you can see in the first box, when you're thinking about things you can't control, that's really awesome, constructive problem solving. It's great opportunity seeking. It's, You're in the zone, as it were, because you're now putting your energies onto things that you have an impact over. However, some of us, and some of you may be out there, spend a lot of time thinking about things that we simply have no control over, like endless worrying. Good example of this would be my mother. She's elderly now, but every day her biggest concern is the weather, of which she has absolutely no control over. And she spends an inordinate amount of time worrying about whether it's going to rain, snow, be frost, whatever. And it's just, I keep having this conversation with her, Mom, like, you know, you can't control that. Why don't you focus on the things you can't control, but you just can't move off of that. When you're putting your mental energies on, and you're not thinking about things you can control, as it mentions in the lower left quadrant, that's a missed opportunity. And somewhat, you know, maybe living in a bit of a fantasy world or living in a world of denial. And I'll freely admit that sometimes that happens, especially when in the middle of crises like we're in now. And of course, if you're not thinking about things that you have no control over, well, that's awesome because you're conserving energy in your fact, you know, that's a pretty good place to be. What we're really strongly advocating for anybody, leader, employee, doesn't matter, but really to try and refocus your energy onto the things that you can control. And in that context, although we don't have a slide on this, what I always advocate people do is take 5 minutes, really, it's all it takes, and take a piece of paper or your computer screen, whichever you like to use best. I like paper, I'm old school. And I draw a line down the middle, and on one hand, I put, the things that I can control, the things that I can influence, and on the other hand, I put the things that I cannot control, the things I cannot influence. And very quickly, a picture will start to emerge for you, and that is, how much of the time am I spending on things that I have no control over, and to try and remove them from your day-to-day activities, and instead focus on the things that you can control. And I think that's a great way to help get your mental energy focused and not exhaust yourself, quite frankly. So let's move on to the next slide. So in terms of your leadership, there's a couple of things that I am very, very passionate about, and I will apologize ahead of time for the passion. But that is, can we all please stop saying the new normal? This is not normal. What we're going through right now is not normal in the least. It may be a new reality for us. We certainly hope it's going to be a temporary reality, but normal, I would beg to differ. Notwithstanding the great work that CanWaCH does in a virtual organization, but virtual organizations are the exception, not the rule. And there's a reason for that. And the reason for that is that human beings are social creatures. We crave social contact. So when you see a sign saying, keep your distance from somebody, that's foreign to us as human beings. In fact, you look at the science behind it, the biology behind it. When we connect with each other on a physical level, it's why when you haven't seen somebody for a while, your instinct is to hug them or minimally shake their hands, which now is like a big no-no. But there's a reason for that, because we actually release a little thing called oxytocin. Most of you know about this. It's called the cuddle hormone or the love hormone. And that hormone, when it's released when we connect with each other. And the great thing about that hormone is that it's a stress reliever. It actually lowers cortisol and lowers your blood pressure. So think about it. When you're under stress, the thing that your body craves more than anything else is oxytocin, which gets released when you have physical contact with each other. So right now, when people say to me, oh, this is the new normal, physical distancing, 6 feet, and I'm highly stressed, I'm saying that's contrarian to everything we know about human beings. So one thing I'm going to strongly advocate we all do is we say maybe it's the new reality, but let's get rid of this term, the new normal, because I don't think that what we're experiencing right now is normal by any stretch of the imagination. Secondly, I think the other thing that I would strongly advocate we stop doing is stop saying that this is business as usual. This is not business as usual. This is anything but usual. And the reason for that is a little thing, and those of you who study psychology probably know this a whole lot better than I do, but it's a little thing called cognitive dissonance. When the behaviors are inconsistent with what your brain thinks to be reality, your brain will try and manage itself to accept that reality as being okay. And I just strongly believe that right now, this is not okay. It's okay to say, this is not okay. It's okay to say, this is not business as usual. Are we flexible? Alli mentioned that, flexibility, important. Do we have to pivot a little bit? Yes, I think we do. But I don't think we have to accept this as carte blanche, as this is going to be the new normal or business as usual forever. So next slide. In terms of leadership, and Alli mentioned this at the outset of her comments to start us off today, it's really about focusing on your people. And there really are four universal truths of everybody who's a follower of an organization, and anybody, really, probably everybody on this webinar here today. And those four universal truths are as follows. Number one, we all crave hope. You know, Barack Obama ran on a campaign of hope back in 2008 and resonated with a lot of people because at that time, you will recall, we had just come out of one of the deepest recessions in a long period of time. Hope is the one thing that keeps us going. Hope is the one thing that really energizes us. And right now, I'd argue what the world needs more than anything else is hope, because we have a lot of negative news out there. People also crave trust. Trust is absolutely inherent. I'd argue that part of the reason we're seeing the US struggle so much with this pandemic is the lack of trust that exists in that nation. I wouldn't say that Canada is completely immune to that. Certainly we have our issues, but I think we have a bit of a deeper trust of our governments and our leaders than perhaps in the South. I don't know, not to get political, but trust is so important. If you looked at the Edelman Trust Index that came out last week, I don't know if people follow this, but every quarter or so, they came up with a survey that says, how do people around the world, how are people seeing trusting people? Unfortunately, leaders of organizations were dead last and politicians were dead first. So ironic, because that had switched around for some period of time. So I think we need to work on trust. I think we also need to work on compassion. People want people, and again, Alli sort of alluded to that at the outset of her comments, you know, being compassionate and being empathetic, which is the next slide. And then finally, people want stability. And if you think about those four things right now, I would argue that anybody on this call today would be hard pressed to argue that they're not looking for those. Right now, we're looking for hope that we're going to find a vaccine or a cure. Right now, we trust that the politicians and business leaders are doing the right things for us. Right now, we're looking for compassion and people that are saying, you know what, it is a hard time and we get it. And I think also, you know, and we're seeing this through government interventions and organizations that are trying their best to keep people employed, to provide that level playing field and that stability for people. So the next slide, please. So I believe that empathy is crucial as well. And in fact, I would argue that, in a little play on words in English anyway, which is, you know, the CEO is really the chief empathy officer. That empathy is the piece of the attribute that I think most leaders really need to thrive on right now. Everybody right now is feeling under stress. Everybody is confused right now. Everybody is in fear. You know, and it's about walking a mile in their shoes. So, you know, let's face it, work from home for those that have been thrown into it is complete, absolute, utter chaos. We have team meetings every morning as a way to keep connected with our team. And, you know, I feel so bad for some of the employees that work for our firm. You know, they've got kids that are hanging off of them. They've got dogs in the background that are barking. In my house, I actually come into my office because I'm the only one that's in this building. And the reason I do that, because my house is complete chaos. I've got dogs barking. I've got kids fighting over Wi-Fi. And it's absolute chaos. You know, and here's the rub. Prior to this pandemic, only 40% of employees and organizations felt that their boss actually cared about them, which meant 60% of employees prior to this pandemic felt that their boss, their leader, didn't care about them. And this is such a great opportunity for us to demonstrate that, because right now, more than ever before, employees are looking for that. And when people feel a sense of safety, and when they feel trusted and when they feel empowered, they will walk 100 miles for you. They'll walk on broken glass to see your organization succeed. So the next slide, a couple of things. And the nice thing about doing virtually, nobody has an actual hook they can grab me, although they can probably turn off my screen and mute me. But nonetheless, just let me know when I'm going over time. So communication, of course, is key. Communication, it's fascinating. We're in a consulting world. We do HR consulting. The number one question we always get from every organization is, can you help us fix our number one problem? And the number one problem always turns out to be communication. So we're a firm of 9 people. We could be a firm of 900 or 9,000 people. I'm going to argue that every single one of those organizations has a communication problem because we assume an awful lot. Never ever assume. You know, it says in sales, if any of you are in sales or in an influential or persuasive type of role, you know that in order for a message to get through, you have to repeat it 7 times. So if you're trying to persuade somebody to buy a product, if you're trying to persuade somebody to adopt a program that you're promoting, you have to communicate that 7 times before that message gets ingrained into their brains. So yet, as managers and as leaders, we often think that one and done. Yet, if we're trying to persuade somebody, it's 7, but if we're trying to communicate an idea, it's only 1. I think there's probably a happy medium that we have to get through there. People need constant communication. So, and there's different forms. Some people are great visual learners. Some people are more listeners. Some people need to be active, and that's really hard in a virtual context, but nonetheless, communication is key. Next slide, I think, is another key piece, and that is communication is listening. There's a reason we have 2 of these and 1 of these, because we need to listen to our employees, and not just listen to hear, but listen to understand. These, you know, they're on the front lines. They're seeing what's going on. Listen to those people. They know what's happening. They can give us great insights into things that we may be missing, especially if you're in a leadership type of role. Next slide. The other thing that is absolutely uber mission critical, as far as I'm concerned, is to give employees control. Right now, many organizations, and I imagine a lot of you on this webinar have experienced this, that you had to pivot very quickly to a work from home scenario where employees maybe had to get into a situation where they had to set up a home office very, very quickly. And that was a feeling of loss of control. The reason that everybody went absolutely wild at the outset of this and you couldn't buy toilet paper to save your life was because that was one of the few things that as human beings we could actually feel we had control over, is stockpiling something we thought we were going to need. Hand sanitizer and toilet paper flew off the shelves because we could control that. It's a little thing called agency. And agency is really the ability for us all to act independently and make our own choices. It's at the fundamental human condition. We thrive on the ability to be in control of our own lives and not be controlled by others. And one of the things that can be really daunting for a lot of employees is when they lose that sense of control. So give employees control back. There are 3 things, the trifecta of good engagement of employees. One is to give them autonomy, which is what control speaks to. The other one is to give them a sense of mastery, that they're performing in areas where they can get really, really good at. And finally, and I don't think I'd have to argue that very strongly with this group on this particular webinar, but a sense of purpose. Everybody thrives on having a purposeful role and what is our job. So aside from giving them the control and the autonomy, let's throw in that mastery and purpose thing as well. My final comment on this, and I'm really shoehorning in a lot of information in a short period of time, so hopefully we'll have questions and address towards the end. Next slide is really, at this point, is you're trying to, as best as you can, to reduce the unknowns. You know, right now, there's a lot of unknowns. We don't know how long this is going to last for. We don't know if we're going to be opening up our economies in a week or a month or a year. We don't know. And that's really, really daunting for us. It's very hard for human beings to deal with the unknown. We really, really don't do well with that. Ambiguity is not our friend. So as much as you can, to provide as much information as you possibly can. This is not a time to withhold information, unless of course it's proprietary or private, but to provide as much information and to even say, you know what, I don't know, but here's what I'm going to do to find out about something. And I think that becomes critical because with predictability comes some degree of productivity. And when you give that generous direction, when you minimize that ambiguity, and you're not vague or general in your commentary, when you become specific, you know, we need, you know, for example, a deadline or assignments or priorities or work goals. When you can get more specificity to those, I think that gives a greater sense of predictability and a sense of things are going to be okay, a sense of structure that sadly is lacking for a lot of people right now. People are struggling with this. And it's incumbent upon us as leaders to be able to provide them that level of comfort and structure and stability that they're craving right now. So the next slide, I think everybody should be doing this. This is a bit fun, but you know, if you look at the research, sunlight produces serotonin, and that helps lower our blood pressure as well. So while we can't go out and get hugs, we can certainly go outside and get some sunlight, which is really, really helpful to us. So believe it or not, and you've experienced this, I know this, I'll bet everybody here $1 on this one. When it's a nice, bright, sunny day outside, your spirits just move up just that much more. So when it's a nice, bright day, it's a beautiful day here in London, Ontario, get outside and grab some sunlight, really, really helpful, especially when you're under stress, which I would argue we all are right now. Next slide. And this is a bit of parental advice for you all out there, and I'll apologize ahead of time for this, but I'm a big proponent of this. I've been studying this for the better part of 10 years. We're not very good at looking after ourselves, and one of the things we don't do very well is sleep. And right now, because of the world that we're in, which is topsy-turvy, upside down, we're exhausted. Just right now on this Zoom meeting alone, one of the most difficult things as a leader you're going to have is you have to maintain laser focus on all of the employees if you're doing meetings by Zoom, because your body is missing, your brain is missing information that it normally gets readily, which is nonverbal communication. When you're limited to a face shot, you're not getting, you know, the full body, you're not getting the full view of the nonverbal communication. You have to be much more focused. At the end of a Zoom meeting, they call it being zoomed out right now. People are zoomed out because they're doing too many of these meetings. It's exhausting. So get lots of sleep. This is a time when your body is going to be craving it to replenish itself. It's absolutely vital to productivity. It's absolutely critical to creativity. And just keep in mind, if you're one of those people like my wife, and I scream at her, not really, but she'll go to bed and on her iPhone or her iPad, and that's blue light, which just totally disrupts your sleep. Put those aside, actually get them out of the room. It just messes with your brain. So who would have thought that a conversation about leadership would come down to something as simple as sleep? But even if this is the only nugget you take away from today, I'd argue you're going to win big on this one, because this one's huge.
Hi, thanks, Alli, and thank you, CanWaCH, for inviting me to join you today. A little bit of a couple disclaimers before I start. I am at home, and the 5 people and dog who are with me have been warned, but the door is not locked. So like my last meeting, 2 people came running in. I also have a bit of allergies, so excuse my voice if it cracks a bit. As we've all heard, there have been so many programs, just constant stream welcome programs from both the federal and provincial governments offering assistance. And my discussion today is going to focus on a couple of them. The federal COVID-19 economic response plan has been categorized into support for individuals, support for businesses, and support for sectors. And what I'm going to focus on today is 2 things, and I apologize, but I can't see my slides, so I don't know what I set up wrong here. But what I'm going to focus on is the Canada Emergency Business Account and the Canada Emergency Wage Subsidy, otherwise known as the CEBA and the COOs. And that's another thing. There have been a plethora of additional acronyms introduced into our world. At Davis Martindale, we are an accounting firm, and I'm a tax partner. And we have focused a lot of time and energy and learning on a number of these programs in order to assist our clients, because a lot of them can get quite technical. And with that in mind, my slides are a bit technical. I'm not going to repeat everything on them, but I wanted to give you sort of a little bit of meat to take away with you so that you had some reference material to go from. In terms of, I'm at the slide right now that starts with CEBA. Sorry, I don't know what I did wrong not to see them. So the CEBA is a one-time $40,000 interest-free loan made available through financial institutions and guaranteed by the Government of Canada. As an added bonus to the ready availability and the interest-free nature of it, 25% of the loan is forgivable if it's paid off by December 31st, 2022. Now, the purpose of the loan is to assist organizations in covering non-deferrable expenses such as payroll, utilities, property tax, insurance, and even assistance with servicing regular debt payments. Next slide. In the context of the CanWaCH membership, the organizations that will be eligible for the CEBA are those that are registered charities or not-for-profit corporations and who have a portion of their revenues derived from the sale of goods or services. Next slide. Just a couple notes. You basically had to be in existence and have an active business account, which isn't a problem for your membership, typically with a financial institution on March 1st. And next slide, please. One of the broader criterion for everyone is that you had to have had payroll as reported on the T4 summary of your 2019 T4 return of between $20,000 and $1.5 million of employment income. That was originally $50,000 to $1 million, and then it was since expanded. And you must have an existing CRA business number or charity account. Next slide. Now this application process is unique, and it's only done online. And what participants need to do is go to the website for their financial institution, and this has to be the financial institution that you primarily bank with, and that's the only institution you can go to. If you have a number, you have to decide who's your primary financial institution. There will be a portal, and you go in and you apply. There's no opportunity to talk to anyone or to visit anyone. It's totally done online, unlike most programs, but it is easily accessible. Next slide. So that's it for the CEBA, and now on to what we refer to as the COOs, or the Canada Emergency Wage Subsidy. It's fairly well known, I think, at this point, but basically there's an up to 75% of wages for employees that the government will help you fund in order to keep, the goal of it is to keep people employed, right? They're trying to keep the employment rate down, or unemployment rate down, sorry. Next slide. So the key marker for being eligible for the COOs is a decline in revenue. And it's basically looking at March at a 15% decline and all the subsequent months as a 30% decline. March is 15% because this whole thing kind of started mid-March, so they lowered that threshold accordingly. Next slide. I'm going to talk a bit about the measurement of your declining revenue, and one thing to keep cognizant of is the qualifying aspects in terms of, March, April, May, June, however, are different than the actual eligibility qualifying periods in terms of, the actual payroll and whatnot. So there's a little bit of misalignment, but I have a slide later on that'll kind of set that out, and you can refer to that later on. Originally, the program was announced for there's 3 qualifying periods, and it's March 15th to June 6th. On Saturday, May 9th, the Prime Minister announced that it would be extended, and that was envisioned in the legislation as it was written to possibly be extended as far as September 30th. At this point, unless something happened today, I'm not aware of the current extension, but other than he said it will. Next slide, please. In the context of CanWaCH memberships, the eligible entities are registered charities and nonprofit organizations, and which you would assume that you need to have a payroll account on March 15th. That's easy enough. Next slide. Public institutions are not eligible for this, and I've listed out sort of the broad categories of that. Next slide. So I keep talking about qualifying revenue throughout this, and so what is that? When I talked about the CEBA, I talked in terms of you're eligible if you've got a component of your revenue that's sales of goods and services. For the purposes of the COOs, it's broader than that. It's all of your revenue. except there is the opportunity to elect to disregard or exclude government funding. So think of this in the context of your organization is, say, 50% government funded, 50% dependent upon donations. So what this allows is your government funding is stable, but perhaps given the current economic climate, your donations have started to stymie or stall or dramatically decrease. So you can just look at the donations in terms of how your revenue is affected rather than all of your revenue, including the government funding. Next slide. So determining your revenue for this purpose is sort of a two-step process. You need to measure your revenue and you need to compare it to forget the actual term, but there's a set out comparable periods, reference periods, they're called prior reference periods. So that's a two-component thing. What is my revenue, and there's special rules, and how does it compare to the prior reference period? Next slide. So in terms of the, hold on. Oh, sorry, I jumped ahead of myself. In terms of measuring revenue, you use your normal accounting practices, but the government, for the purpose of this, has allowed the entities to look at revenue on either an accrual, which is the typical basis we usually account by, or a cash basis. So if you're billing away, but you don't know if we can bill all we want, and that constitutes our revenue. But if the cash doesn't come in the door, that's another matter. So there's this ability to elect to measure on a cash basis for the purposes of determining whether you qualify. Once you elect to use the cash basis in one period, you have to continue through all periods. You don't get to toggle between the two. So it's a decision you have to make and stick with. And I'm going to talk about in terms of when you make that decision a little later on. In terms of the comparison part of this, so March 2020 is one period that you have to compare. So you can compare that to March 2019. Is it 15% lower than that? Or you can elect to compare it to the average of January, February 2020. Similarly, April. Compare April 2020 to April 2019, or an average of January, February 2020. Now, the significance of this is if you're a relatively new business or organization and you've been growing, naturally, even though perhaps your expected revenues have dropped for March 2020, it's still better than last year because you were growing. So what the January and February average allows you to do is sort of make it more relevant in the context of those growing organizations. Similar to the accrual versus cash, you adopt your method and you have to stick with it throughout the whole period of the COOs. Next slide, please. So this, I said to you that the comparable, the periods that you compare don't line up exactly with the actual eligibility periods, and you can see on this slide how March 2020, or sorry, next slide, I'm ahead of myself. Sorry, one of the other key things to remember, they simplified this in the sense that if you qualify in one period, so say you meet the 15% drop in revenue for March, you automatically qualify for the next period. So if, so now you're eligible for March and April, or you've met the qualifications. As far as May goes and beyond, so for May, you either had to have qualified in April, which made you automatically qualify for May, or you have to qualify for May in and of itself. So it just simplified things somewhat, and it may not. I recall I said you have to pick your timing in terms of when to choose your methodology. So you have until September 30th to apply for the COOs. So sometimes it might be better just to wait to see, even though it might be better right now, March and April, maybe over the course of this whole program, when we see how long it lasts, you might have been better to choose another method. So you might want to wait if you're not cash strapped right now to apply later. next slide, and I'm on the one that begins with eligible employees. So just the thing to take away from this slide is the COOs was designed to interact with the CERB, and the CERB is the Canada Emergency Response Benefit that we've all heard about. That's the $2,000 a month for people who have been or who are out of work. So one of the key criteria for the CERB is that you are out of work for 14 or more days in the qualifying period. The COOs is tied into that to say that you don't get the COOs for an employee who has been out of work for 14 or more days in a qualifying period. You can see that they don't want a double dipping. The employee gets the CERB and the employer gets the COOs in respect of that same period, and a double counting of that. So you need to be cognizant of that in terms of how you can, and if you do, you can pay the COOs and it will all of a sudden trump the CERB, and the employee will have to repay the CERB. So next slide, this is the one where it's talking about how the qualifying periods and the eligibility periods aren't an exact match, but you can see how that works. Next slide, please. So the actual subsidy itself, in terms of a calculation, it's 75. It's the lesser of 75% of the individual's wages in respect of a week, and $847. And that works out to, so that 847 is sort of your maximum. It's very similar to the EI maximum. It's about $58,000 and change. So anyone over that in terms of their salary, they will be limited to the 847, or the employer will be limited to $847 a week in respect of that person. And then the people under that threshold, it's 75% of their wages and salary. And in terms of, so that there's a limit in terms of at each employee and their wage threshold, but there is no limit on the total amount that an employer can claim. So there was reference on the website to, if you're CRA's website, if you're an employer who is expecting like a $25 million or more claim, you have to go through this whole other system. So the magnitude of this is mind-boggling. There's no limit for our particular employee. Next slide, please. And interesting to note, I said that it's 75% of the wages in respect of that week. So it didn't have to be paid in that week. And what this allows is it allows employers to pay retroactively. So perhaps they laid someone off, but they'd like, now that they know they can get the COOs, they'd like to go back and top up their pay to what it would have been. The other part of, if someone was laid off and is being, but wasn't, is being paid, so, but wasn't working, was being paid, there's an opportunity to apply for a refund of the employer portion of CPP and EI in those situations. Next slide, please. Excuse me. The application process is completely online. Most entities will have something called My Business Account, which is with, even though you're not a business, it's how you would access your payroll account. And you go online. The CRA has, they've really done a great job with the website and the information. It's constantly being updated with new information. They're having just calls all the time to answer questions. There's also on the website an Excel workbook that's a COOs calculator that employers can use to help them, because you have to almost do it on an employee by employee basis and whatnot. The applications online opened May 4th. We're of the understanding that the payments will be starting soon. Some of them will be flagged for review right away. Some of them will go right through and then be reviewed post payment. Next slide, please. This is the one that says application process. What's important to note is that so the person with primary financial responsibility has to they have to attest. So they're really, there's been a lot said about that this will be scrutinized. They realize that it's susceptible to abuse. They wanted to roll it out and get it going to help employers, but they're not going to just let everybody get away with things. So they expect an attestation. So if you've got, so if I'm CFO and I'm a CPA, kind of putting my designation on the line when I do this attestation. So, and then the other thing, and this last comment I just heard this morning, where I say that if there's no ability to go back and correct, that was the way the legislation was written. The CRA has administratively since said, no, you can go back in and online and make changes after the fact. Next slide, sorry, penalties. Not going to say much about that. Again, they have warned about people abusing this, and they will be scrutinizing it. And they've introduced, if you try to manipulate revenue in particular, they've introduced some very significant penalties in addition to the ones normally applicable under the Income Tax Act. Last slide. I recommend that you go to the CRA's website and learn. There's so much more there. I could talk for an hour about this, honestly. There's so much more detail there, and they'll learn lots, and keep going back to it because there's more information coming all the time. And thank you very much.
Amazing. Thank you, Brenda. And cognizant that we are at the top of the hour, what I'm going to say that we will do, I think we underestimated just how much information there is to share. I could have, as you said, taken many, many hours to talk through this. I encourage you all to continue to send us an email, ask us questions, email us over the coming days, and we will follow up. So we received a couple questions in the Q&A box, and we will follow up via email with responses to those. One very quick question, there was a question about the name of the platform that we use for our online office, and that is called GLIP, G-L-I-P, which has been bought out by Ring Central. So Ring Central is the actual name of the platform. There's a couple other questions that we've received, but as I said, we'll follow up via email for those. But I'd like to give a huge thanks to both Terry and Brenda for your time today and for your expertise and in sharing that with us. And to each of you who have joined us today on this webinar, we're absolutely thrilled to have you here and really encourage you. Our email addresses are listed, so encourage you to reach out to us with any questions that you have. But thank you so much for all being here today. Thank you to Terry and Brenda. Thank you to the CanWaCH team for all the back end work that's happened. And a big shout out to each of you, and keep us posted on what's going on with you. In terms of next steps for CanWaCH, next Wednesday, we have a menstrual hygiene and fragile and humanitarian context webinar. And alongside a follow-up for this webinar, we will list other webinars that are coming up over the next month. We have webinars every Wednesday at 1 p.m. So again, thank you all for joining us, and keep questions coming. Reach out to us via email, but lovely to see everyone today. Thanks very much. Bye.